let's be honest, I won't be needing those, it's hardly sterile in here. Today we're delving into the world of medicine and surgery, and I've pulled from across the collections all the tools a surgeon would need, from gruesome bleeding bowls to intriguing anatomical models. A lot of these objects date from the 17th and 18th centuries, where medical understanding into infections was minimal and the mortality rate after surgery was very high. Sit back, try to relax, you might feel a little discomfort. It's time for Laying the Table, Surgeon's Edition. When I was pulling together objects for this video, I came across this puzzling instrument here. Keep watching to find out what this mystery object is. An important part of your surgical training is to read copious amounts of textbooks, but also to consult anatomical models like this object right here. Inside is a model of a pregnant woman. It's carved out of ivory, a material which we wouldn't use nowadays for models. It was probably used as a teaching aid for midwives and medical students. There's a set process for removing the parts from this object. It's like playing a very complex game of operation. First of all, we lift up her arm to reveal this small ivory pin which we remove. After that, the front section can be lifted off. You can see underneath there are her intestines, which we have to gently remove to reveal a small vellum flap that we lift off. Underneath is a womb, and there's a little baby inside connected by this umbilical cord. You can see her internal organs. There's, I think, the heart, lungs and liver. Her stomach seems to be missing, and all the organs seem to be the same shape and size anyway, so I probably wouldn't recommend this for medical students to look at nowadays. They're not the most anatomically correct, but at least they're well organised. Another important part of medical training in the 18th century was learning about bloodletting, and bloodletting stemmed from the theory of the four humours of blood, phlegm, black bile and yellow bile, and an imbalance of these could be readjusted by bloodletting, and you could collect the blood in a bowl like this. It's made out of pewter and it takes the form of a one-handled porringer, and these types of bowls could be used to serve soup or porridge, or why not collect some blood? Inside the bowl you can see these concentric rings, and these are used to measure the quantity of blood taken. It's like quite a lot of blood as well, look how much to reach the top line. Oh. Now you know you've made it as a surgeon when you can afford an instrument case like this. This is a barber surgeon case and it dates from the 19th century. It was made in Iran, and the user of this case would have been adept in both cosmetic and surgical procedures. There are instruments which are very much part of the barber's domain, with razors like this, as well as combs for hairdressing. And then also more surgical tools such as forceps and knives to take part in minor surgical procedures like dentistry and setting bones. Whilst the case has a very practical purpose, it also shows great artistry. It is a beautifully lacquered case painted with scenes of Christian iconography, and they have these recesses for all the tools to neatly slot in, so it's a very satisfying object to look at. Sadly, not all tools are as glamorous as this barber surgeon case, and we have this tooth extractor here. It works basically like a pair of pincers, so you clamp it onto your rotten tooth and then yank it out. Tooth extraction at this time, in the 18th century, would have been carried out by a variety of people, including travelling tooth drawers who operated at fairs and marketplaces, and also tooth operators. Tooth operator! Who both removed teeth and made artificial teeth. Now, the field of dentistry expanded a lot in the 18th century, with the term dentist first being used, and also developments such as tooth transplants and porcelain dentures. Whilst extracting a tooth is definitely uncomfortable, I think amputating a limb is probably a lot more painful. And we have an amputation saw here which dates from 1660. It's very ornate. You can see there's a wolf at the edge of the blade, and it almost looks like a parrot on the handle, which is made out of ebony and inlaid with ivory and amber. Perhaps it was meant to distract the patient as their arm or leg was being sawn off. If you look closely at the blade, there is definitely signs of wear. There is lots of high relief ornamentation, but unfortunately these raised areas would be the perfect home for bacteria. Coupled with the fact that surgeons rarely wash their blades to prevent rusting, means that the risk of infection after surgery was very high. So I'm not too sure about the survival rates of using this instrument. The wait is over. It's time to reveal the mystery object. Mystery object! It is in fact a bullet extractor, and it dates from the 1600s. It's made out of steel, and the way it works is there's a screw mechanism on the top that you would turn, which extends this tube, which is meant to work out where the bullet is in the wound and then extract it. I'm not sure how successful it would be. It's not the most flexible of objects, but at least they were attempting to save someone's life, so you know, that's something, I guess. The instruments are laid out and we're ready to operate. Count back from 5, 4, 3, 2. That was not the ping that I wanted, that was rubbish. Oh no, that was rubbish. You can't ping it. I want to do a ping. Oh God, I can't remember the other development. Oh God, so close. We can do mystery object. I feel like I'm more serious. I'm like, facts. Whilst, oh, I said that really loudly. That was wild. West Coast and to LA. No, I can't remember it.